Hello, everyone. Thank you for joining us today on this Demonstrating Implementation Excellence stream at the SNOMED-CT Expo 2023. My name's Susie Roy. I'm the Customer Relations Manager for the Americas, Collaboration Specialist, and Research Engagement Lead at SNOMED International. I'll be moderating today's session, so anyone who has questions online, please be sure to put your questions in the Q&A box at the bottom of your screen in your Zoom. And those in attendance here in the room, hello. Make sure you go up to the microphone and use the mic to ask your questions at the end of today's presentation. We do have people online and they will need you to use the microphone, please. So I am pleased to introduce Beatriz de Faria Leao from the Hospital Sírio-Libanês, who will be presenting construction of the immunization component of the Brazilian IPS, International Patient Summary, mapping of local vaccine terminologies to SNOMED-IPS. Beatriz?
Thank you very much, Susie. It's really an honor to be here. I never expected our paper to be accepted for our presentation. I must say this is a teamwork from Hospital Sírio-Libanês that is doing the IPS project for the Ministry of Health using a tax exemption program that the country has for 6 excellence hospitals that instead of paying the federal taxes, they have to submit projects for our national health system. So the IPS is one of those projects and is being done by Hospital Sírio-Libanês. We work together with the new Digital Health Secretary that was recently created at the Ministry of Health in Brazil. So you all know what the IPS is, an electronic health record that contains essential health information to be used in unscheduled cross-border care setting, but can also be used as the national summary for continuity of care. And that is the Brazilian decision. We are going to use IPS internally as well. The IPS project attends three of the 7 strategic axes of our National e-Health Strategy that was published in 2020. The support for better healthcare delivery, since we will interoperate data, to put the user as a protagonist, since it is the consumer, the patient, that will request his or her summary, and of course, the interoperability environment. I already mentioned that it is a project on collaboration with the hospital. So currently we are deploying the first phase of the project. This was a 1-year project starting January 2023. And we are able to do the immunization, problem list, medication summary, and allergies from the content. We still do not have the problem list completely solved. So the Brazilian Digital Health Strategy is based on a national network that has health information from everybody in the country. So our national registry of immunization, that is of mandatory information to the federal level, has now 1.4 billion registries of all vaccinations in the country. We also have a 71 million register of COVID-19 and monkeypox exams that, well, the epidemics gave us that. We had to raise the interoperability between the labs to have all the results, and they all appear on an app on the telephone for all patients. And we are starting to send all primary care encounters also to this federal network. By the moment, it's only 120,000, but this number will increase. This paper addresses the issue of the 103 list of vaccines and antivenoms that the Brazilian National Immunization Program has, and how we had to map them to the SNOMED-IPS subset to do our immunization section. And of course, we use the ISO mapping standard on how to map and build the equivalence between the terms. So the list, as I said, has 103 terms. Some of them are diluents. This is a list created by the government under the National Immunization Program. Here is the total mapping equivalence degrees from all levels. As you may see, we got almost 40% with semantic interoperability with level 1 or 2. But we had several of them on level 4, meaning that the Brazilian description was more detailed than the one on SNOMED. And I'm going to address specifically these ones that we were not able to map and why. So here you have an example. Oh, sorry. Here we are using the Open Concept Lab terminology server, that is an open source terminology server. And here you can see the Brazilian list, and you see that, I don't know why, they added the manufacturer to the name of the vaccine. So when you map to SNOMED, you have to map saying that the Brazilian has a narrow description. All the COVID vaccines in Brazil are described with the name of the manufacturer. Don't ask me why, but they have done that. And when we map, we have to acknowledge that. So those are the lists of antivenoms that and vaccine codes that are not even on SNOMED-CT itself. And my pledge here is that those antivenoms and those vaccines should be on SNOMED-CT, because this is a matter of a public health problem in the Southern Hemisphere, Africa, Latin America, and Central America. And so we have specific snakes and spiders, and we have this lady here. So if you come visit us, please don't step on this lady here, this Lononia, because she can kill you very, very fast due to hemorrhage, and it gives you acute renal failure. So Brazil produces these antivenoms, and it's really, we send them all over Latin America and Central America, and we have saved several lives. So come visit us, but don't step on the Lononia, okay? And have a look at this list, because we really think they should be on SNOMED. And these ones are the codes that are in SNOMED-CT, but they are not on IPS. As most of you know, Brazil has entered in SNOMED, has left SNOMED. We are hoping things will change for the next year, but still, and we have to use IPS set. So the pledge here is that this list also enters on IPS. You have things like immunoglobulins, but you have the pneumococcal 10-valent vaccine. I don't know why it is not on IPS. It's a very common vaccine. You also have the measles and rubella vaccine that is not there. So those codes should definitely be on IPS. Since they are not, this means I will not be able to produce the immunization section for those vaccines for all the Brazilian patients, because they are not on IPS. So that's a problem for our summary. And I want you to understand that. So a little bit of history of the Brazilian, we are very proud of our immunization program. It started in 1975, even before the National Health System. It is a mandatory program all over the country, and we have 2 institutions that produce vaccines and antivenoms in the country. The oldest one is Instituto Butantan from São Paulo, that produces all those antivenoms that I showed. And on top of that, it started producing during COVID the CoronaVac vaccines. And the Institute Biomanguinhos from Oswaldo Cruz Foundation in Rio de Janeiro, that is a little bit newer institution, but also doing all the yellow fever, pneumococcal, polio, oral, rotavirus, and so on. So we are really very proud of the program. Here is a picture of those 2 institutions. And the national program is mandatory. Everybody has to be vaccinated. I want to, as I mentioned, antivenom and snake bite and all those very tiny animals that can kill you, it is a public health problem. It has been identified by the WHO, and they say the numbers can be as big as more than 1.4 million deaths per year. So really, I think those codes must be included in SNOMED. In Brazil, we have to mandatorily report any antivenom application to the federal level. It is considered not a disease, but a procedure of mandatory notification. That's why we have of those 1.4 billion. And this is a paper very recent from the BMG Global Health, how and why snake bite became a global health priority, a policy analysis. So that's my pledge. So going back to the International Patient Summary, Brazil is also part of the Global Digital Health Partnership that, as you know, IPS began with a G7 initiative that it increased to G20, and now it is on the GHDP that has more than 33 countries, and it is growing every day, and also 3 international organizations like WHO, OECD, and IDEA. And the GDHP group is really working hard with use cases and demos on how we can share IPS across the global. So there will be a connectathon between the Americas countries, 20 countries from the Americas, including US, Costa Rica, Peru, Bolivia, Colombia, Argentina, Uruguay, Chile, and so forth, are going to participate on track 1, that is the IPS Raxel connectathon now in November. And here you can see, this is a print of our screen that shows our IPS visualizer up and running. And we believe that by having the patient summary in IPS format, Brazilian citizens will really benefit from this. Today, Brazilian citizens can get their immunization, their medication, every encounter they have in primary care, but you see, they would have to go for each encounter. If you have the summary, you would be able to gather information from different sources and produce the summary of the patient. And also visitors to Brazil, that I hope many will come, will be able to show their summary to any of our providers, and they will be able to treat you better. We believe the IPS RefSet was a major achievement for countries like us that do not yet have the license, but can be able to use an international standard to share information. But it is mandatory that the terms that we showed here must be on either SNOMED and then move to SNOMED-IPS. And today, I think SNOMED is absolutely fantastic, but it looks very much to the Northern Hemisphere, and you should definitely look to the Southern Hemisphere. This, I would repeat, it is a public health problem, antivenoms and things like that. So please acknowledge that, and Jane has already this list of items. Brazil cannot ask because it's not a member, but we really would like them to be there so we can provide the proper summaries for our patients and for anybody else that comes. Yeah? So if SNOMED intends to be this international language, it is necessary to accommodate the needs from all over this planet. And I'm sure Africa will have the same issues with their snakes and spiders. And Australia, I know, have several wonderful spiders that I don't know if they are there, but I know they can bite you. And probably New Zealand also has their share of spiders and snakes. I don't know, but maybe. So I invite you all, maybe I ran too much, but anyway, we'll have time for questions. We will have a session today afternoon organized by my good friend Mike Nussbaum, where we will sit together and discuss the International Patient Summary and how we are all developing and making it available. It will be on the Access Room, isn't it? At 1:30. So I do hope to meet you there so we can discuss more about that. Thank you very much, and I can try to answer your questions. Thank you.
Thank you so much, Beatrice. So yes, we'll now take questions. So those online, go ahead and write your questions in the Q&A box, and we will read those. Those in the room, go ahead and go up to the mic, please, and we will gladly take your questions as well. So Beatrice, one of the things that I know we have been working very closely with you on are some of these content requests that have come through. From SNOMED International's perspective, of course, we work with our fellow brother and sister standards development organizations. There's a whole cross-SDO group, which I'm sure Rob will probably speak about a little in your presentation coming up. Okay, all right, never mind. You will learn all about that in our afternoon session, as Beatrice just spoke of that. And I was just wondering, has that process really been helpful? Because right now, SNOMED International does not readily take new requests for content to be added to the IPS, because what we essentially do is allow for the content that's needed from the European patient summary or from HL7 value sets and other things that are deemed as within scope for the IPS. We make sure that we include all of their content that come in from HL7 and from SEN. And so right now we're working on that process, but I'm wondering how, from you as an end user, how is that process?
Well, those lists are not on the European needs, and neither from US. So maybe should we go through the Brazil HL7?
Yes.
Okay.
And it can come to me, and then I can,
Okay.
put in the
Well,
request for the IPS.
yeah, because otherwise we won't be able to show those immunization records from those patients. And
Yep.
I think this is important.
Yes, yep. Can you please use the microphone? It's up, it's in the middle of the room at the stand. Thank you.
I did the review for this value set. I told Beatriz that the use case is for the IPS is the immunization for cross borders, is to know if you are immunized and you don't have a contagious disease that you can transmit. And then this is use case. And the venoms are for the toxins. They are not contagious, and they are another use case for the IPS. For the value set in Brazil is for all of the cases. So for IPS, as a terminologist, using the SNOMED-CT hat, they don't belong to the same use case. I think that you have to put that, but you have to, in terms of the use case of the information model, you have to think, Robert, how to deal with that, because it's not the same thing, okay?
I understand Jussara's issues, but nevertheless, if you don't want to put this on the immunization section, you have to put on the procedure list that patient received that antivenom. And I cannot do that as well because the code is not there. So please.
I'll just say in the microphone this time that I think that this does sound like a very good fit for the immunization section of IPS, and I will touch on that just a tiny bit in my presentation. But and yes, I think that if we can receive the request that from Brazil, and of course similar requests from other countries through the HL7 process, then we can ask those to be included in the next version of the IPS ref set and IPS terminology. So I'd be very happy to
Thank you.
that.
And also, oh yeah.
And for those that are not on SNOMED-CT, that would follow the same track?
Yes, that's exactly. I mean, that's, I'm basically the request person from HL7, for this.
Okay.
If it comes to me, we can, particularly if it's from an HL7 affiliate or whatever, that would be perfectly
Wonderful.
This is via a really strong collaboration agreement that we have with HL7. It's been
Okay.
going on for a number of years. Any sort of content that any HL7 project, HL7 affiliate is needing for their HL7 values, any of their products that they're working on will either go through a country-specific national release center if they are in a SNOMED affiliate country, but if they are not, then they come to the HL7 affiliate process. And
Perfect.
we have a really strong collaboration agreement that we've been doing this via, and then with the IPS in particular, we've been making sure that these content are also fast-tracked. So I was just opening that up so that it can become a little bit more publicly known that there is a mechanism process already in place. And yeah, we can definitely help you filter that.
Thank you so
through.
much.
Yeah, absolutely.
Thank you. That will solve the problem.
Next question in the room.
Hi, I'm Mike Nussbaum from Canada. Beatrice, thanks for coming all this way to present. The issue you just brought up resonates with me because as part of this collaboration of SDOs, we recognize that we need, for IPS, we need some way to govern all of this. And right now it's being done independently through bilateral agreements and through the partners, the SDO partners right now, but we need a better way to do that. So that is on the agenda for our collaboration. We're trying to look forward to some kind of governance model, and we will hopefully have a chance to get input from people here on what kind of governance we might want for IPS. If you come to the session, that's one of the topics that we thought might be an interesting discussion. So
Totally agree.
there is help on the horizon, I hope. The other thing I just wanted to just question, and we discussed this a little bit earlier, you've got a very, very large implementation of FHIR in your country with huge volumes. And that is something that the whole rest of the world is looking at as you're one of the very first implementations of such a high level of volume. Just your experience from implementing IPS at that level and scale, any comments for the group?
Yeah, I think we are one of the largest implementations because of the numbers and so forth. We work with Happy FHIR on top of our open source terminology server, and the numbers are great, are enormous, but it is working pretty fine. I think we were able to leapfrog because we had no interoperability at all, and then we were able to move directly to FHIR. And so I think this was an advantage for the country, you see, to be able to leapfrog directly. And the pandemic helped a lot because the federal government needed the information on the exams and on the vaccines. So they built those implementation guides that are not perfect, really not perfect, because they attend those two specific use cases, immunization and lab results. And now the IPS guide, the Brazil IPS guide, will be the Brazil core guide. And that is an agnostic guide that is not specific to any use case and extensible. I think Canada is doing the same with the Canada summary. So we use the same approach. We also extended the patient with all the sex, gender orientation, and so forth that the US CDA has. So we are working together and looking at the best implementations in the world to put in our implementation guide. So I think this will also foster implementations across the country. But I guess the message is that it works. We have a problem of building capacity in the country. We are not so many people working with FHIR, but we have very good people. There are only 2 persons certified on FHIR in Latin America. One of them is in our team. So we do have a good team, and we are leapfrogging. And I think that's the message. If you don't have anything, jump to FHIR right away. And it works. And it works with open source components with no problem. Thank you.
I think we have time for one more question. Beatrice, so you mentioned that you utilize the ISO standard for mapping guidelines, which I'm totally blanking on the number right now. But anyways,
12,300.
Yeah, thank you. Yes. In addition to that, did you end up developing other mapping rules and conventions for your own local implementation or creation?
We use the ISO,
Okay.
the ISO for mapping and for quality assurance. And Dr. Jussara, that is seated there, that is an author in SNOMED. She has the full course. So she's the one re-evaluating all the mappings we have. We didn't need to add anything else. Most of the mappings, they were either straightforward, equivalence 1 or 2, and we had from this vaccine list several on 4 that are narrower. And I asked the Brazilian National Immunization Program. This was an effort done together with them. I said, why did you put the manufacturer? They couldn't even reply that. I said it was the beginning of the pandemic, the vaccines were coming, and they were just adding the vaccine. So that was it. So now we have to live with that.
Excellent work. Can we give Beatriz a round of applause?
Thank you.